Now, we know that leaders are hoping that a vaccine will help to get everything back to normal, but it can only be effective if people get it. A study found less than half of all Americans say they will get the shot, and that has some experts really concerned. One of them told our Deshaun Brown that they will need to recruit community leaders to get more people on board, especially in those neighborhoods hit the hardest by this virus.
While researchers are hard at work to find an answer in the form of a vaccine, numbers from a recent AP poll suggest only half of Americans would actually get it. The breakdown on responses takes a look by age, race, political party. The most glaring disparity in black and white, with nearly 40% of black Americans who said no.
We know that, minority populations, we know that people with underlying medical conditions, are more at risk. So you're going to want to have outreach. Now, the question is, will they have trust and confidence in, the medical teams or the public health team saying this is a good thing?
Thomas Denny is Chief Operating Officer at the Duke Human Vaccine Institute. He's working on coronavirus efficacy trials right now, with previous work on treatments for HIV.
We went out and met with church leaders. We went out and met with people in the community to let them know the programs we had, that these programs were good for people, that they weren't something negative.
For Charlotte pastor Jordan Boyd, his work as a community advocate is personal. His brother-in-law died from the virus at age 50. Now he and his wife are raising his son.
He called one night to say, I'm going to get tested. I feel really bad, and never came home.
Boyd helped push for testing sites in the black community when there were none. Even now, his church is funneling $50,000 in grant funding into homes of Charlotte families who've lost their jobs or can't pay their bills.
We've got 31,000 of it used already, just in roughly 2.5 to 3 weeks.
Boyd says his advocacy work continues as the country continues to learn more. That includes educating himself on the effectiveness of a potential vaccine and the risk of potential harm.
There's historical track records of our communities being taken advantage of by people who say they have good intentions. It's incumbent upon us to be able to ask those questions and to then be able to stand and say, okay, this is good. But it's also important that those institutions go the extra mile to make sure and to ensure to the communities of color that what's being done is being done in a transparent way.
A lot of responsibility there. That was our Deshaun Brown reporting. Now, even though that study showed people are hesitant to get the vaccine, Duke University officials tell us they have not had any issues getting volunteers for the clinical trials. The director says a lot of people who've signed up for the trials usually have a personal reason for wanting help or wanting to help, but he did acknowledge that may not be reflective of the entire population.